Hello, welcome back. I'm Zoe, the vet physio here at Fit Pet Physio. So this month I wrote a blog all about the best treatment options for dogs with arthritis, and I wanted to share that blog with you. I know a lot of people don't particularly like reading the blog because it can get a little bit boring, but most of my blogs are dead short, so they're dead easy for you to read. But in case you prefer to watch video, you can listen to me natter about best treatment options for dogs with arthritis. So, arthritis is becoming really common, especially in senior dogs. Over 80% of senior dogs are thought to have arthritis. Arthritis also referred to as OA. So if you see those two terms, they are sort of interchangeable in the dog world at the moment. So there is new research emerging for some new therapies that you might not have heard of. So traditionally, we would treat dogs with arthritis with a combination of physical therapy and drugs, and there are some new drugs on the market that you might not have heard of. So let's start with the newest one that has got a lot of attention recently, which is the Librela injection. So Librela is relatively new, really, in the UK. It was released in 2020. It's also known as Bedinvetmab, if that's how you pronounce it. But generally it's sold under the name Librela. It's effective in most uses for reducing pain and inflammation in dogs with arthritis. However, there are some side effects that have become quite common, including neurological side effects and lameness in dogs. It's also thought that it could be linked to something called rapid progressive OA or RPOA. Which is caused when the arthritis that the dog has in a said joint, so say the elbow, for example, progresses much more quickly than we would expect it to, and often outside of the joint. So arthritis typically just affects the joint, so just your elbow joint, and in these dogs we're seeing that sometimes that additional bone tissue that we get in with arthritis is extending down the long bone as well, which is not normal in arthritis cases. So that can lead to severe pain and reduced mobility. There's some research to suggest that that's more commonly happening in dogs that are treated with Librela and non-steroidal anti-inflammatory drugs, which we'll talk about in a second. But there is limited research really in this area. There's not that much research on Librela at the moment. It typically lasts a month on average for most dogs that are treated with it, and they do tend to respond well. But we haven't really compared the incidence of side effects like the rapid progressive OA with dogs treated with Librela and those treated with different modes of treatment and different drugs, for example. So we can't really say one way or another what the actual risk is for those dogs. So, as we mentioned just a moment ago, non-steroidal anti-inflammatory drugs are normally the first line of drug that is given to your dog. So if your dog's ever been to the vets with a little bit of a lameness, or they're not feeling quite themselves, often the first drug that the vets will prescribe is a non-steroidal anti-inflammatory drug. So this is things like meloxicam, which is sold under a couple of brand names like Metacam, Loxicon, Rumacom. And then you've also got things like Rimadyl and Onsior. These come in both a liquid and a tablet form, depending on which drug it is that you are giving. And they help to reduce both pain and inflammation, because we know that there's a huge inflammation presence in dogs with arthritis. We do like to make sure that that inflammation is under control, because if we get the inflammation under control, then the pain is also reduced. However, these drugs do commonly have side effects as well, including mainly GI upset, so stomach issues, sort of a stomach bug or that sort of type symptoms. And you can not give non-steroidals if you do see these symptoms in your dog. Another key factor is obviously going to be physical rehab. So by using a vet physio like me, we can help by using different modalities. So some like laser and pulse mag and massage to help reduce tension and pain in the muscles, reduce inflammation, and then we can also help you with hydrotherapy and remedial exercises to help improve muscle mass and strength, which gives them more stability to these joints. We can also help with practical guidance, having a look around your home, letting you know if there's any areas that we think could be tailored a little bit better to your dog. So perhaps putting rugs down, avoiding certain sets of stairs that are quite steep, that sort of thing. We can also help you with weight management, because weight management is also a key component of arthritis management, as fat tissue contributes to chronic inflammation, and increased weight also increases the amount of force put through your dog's joints every time they move. If you're interested in finding out whether your dog is overweight or not, I will pin a blog post in the description below for you to have a look at, which will help you body condition score your dog so that you can find out a little bit more about whether or not they are overweight. And I will also add a link to the YouTube video on this. The final treatment option I wanted to talk about is joint injections. So these are injectable treatments that usually go into the joint that is affected with arthritis. Things that are commonly used are hyaluronic acid, steroids, stem cells, protein-rich plasma or PRP, and cyanovetin is a new injectable that we're trying to use to not only reduce the pain and inflammation, but also to try and regenerate the damaged cartilage that we get in arthritis. When I went to the NAVP conference last year, we had a whole lecture series on this, and I do actually have a full blog and full day in the life video from that conference that goes into a lot more depth. So again, I will tag them in the description below. So the last little portion for this video is I just wanted to talk about some common symptoms of arthritis that maybe your dog has that you might not have noticed. So I often get behavioural changes, so being a bit more touch sensitive, noise sensitive, a bit more reluctant to run, jump or exercise, general slowing down, reactivity and wanting to play less or being less tolerant of very playful dogs. You might also see movement changes such as lameness or stiffness. These are the two that people most commonly come to me and say, oh, I'm worried my dog has arthritis because they're stiff. You might see changes in gait, so they're not running as freely as they used to. Maybe they're bunny hopping, maybe they're occasionally lifting one leg. They might be struggling to sit or lie down or taking a long time to lay down in a comfortable position. They might pace a little bit more. They might be struggling to do steps or to jump onto the sofa or into the car. And you might notice that they do have some reduced joint movement. So for example, their hip or their elbow may look a little bit stiffer than normal. If you're worried about any of these symptoms, you think your dog might have any of these symptoms, or you want to know more about your dog specifically and whether they are at risk from OA or have OA, then you really should book an appointment with your vet and they will be more than happy to talk through all of these options with you. I really hope you found this video useful. I would really appreciate it if you've got to the end of the video, if you could drop me a comment and let me know. Pop me a paw print down in the comment to let me know that you've got to the end of this video. And if you found it helpful, I'd really appreciate it if you would subscribe. All right, I'll see you soon.